Welcome to Penn Medicine, Becker ENT. This is the audiology department, and we're two of the audiologists. I'm Caren McQuaide.
And I'm Caren Sokolow. I wonder if we could talk a little bit about hearing loss in general.
One interesting stat that I looked up is that 15% of Americans, it's estimated, have hearing loss of some degree, and 2% that can be a debilitating amount of hearing loss. So it's worthwhile, if even just to get a baseline once you're 50 or older, and that should be just routine care. That should be part of, if you're getting blood work, if you're getting, colonoscopy, whatever. Hearing loss is just as important. It affects quality of life. It can affect brain health.
That's right.
So we need people to know what their baseline hearing test is.
I recommend to patients that every year they should probably, if at all possible, once a year, if they can come in and update and make sure that things are the same. It also, again, will help us with the hearing aids, because if your hearing has changed over the course of a year, then we need to update your hearing aids to make sure that they're doing what they need to do to accommodate any changes you might have.
Exactly.
So I think once a year is a great idea to come in.
And another good point to point out is that not everybody is a hearing aid candidate, in that sometimes hearing loss is related to something simple like wax accumulation in the ear. So better not to diagnose yourself. It could also be an ear infection, some fluid there related to maybe sinus issues. So we can't just figure that out on ourselves. We can't look in our own ears. Even if we can, we're not going to know what we're looking at. It's better to come in and get the proper diagnosis. So one of the things that's fantastic here is that we work as a team. We have nurse practitioners and ENT physicians that are the medical arm of our practice, and the audiologists work closely with them, so we make sure you're getting the hearing help and you're getting the medical help, so that, as a team, we're able to keep people hearing.
Keep all the bases covered.
Yes, keep everybody covered. Absolutely.
That's right. I agree. I think some of the more interesting things that I'm aware of and looking into as time goes on, and more recently, hearing loss related to memory and things that some research that's going on.
Something that we mentioned earlier, yes.
Yeah, but even, not that there's a direct correlation, but they're finding information that, I guess like any sense, it's so critical, the input that you have for your brain health, for memory, and they're doing research with Alzheimer's and dementia that is encouraging to think that perhaps the hearing plays a bigger role than we originally thought.
Right. So we do know that people with vision loss and hearing loss that's uncorrected can be at greater risk. Some populations up to 55% greater. So that's a pretty weighty number. And again, quality of life wise, it makes sense to do what you can do to put yourself on the better end of those statistics.
Absolutely.
So hearing health plays a big role. Another thing that's very common for our patients to come in and report to us is tinnitus or tinnitus. Some people say, we tend to say tinnitus here.
In the States,
You can say it either way. It's still, the problem is some type of noise in your head or your ears, and it can be intermittent, it can be variable intensity, so sometimes it's louder, sometimes it's softer. It can be very, very problematic for a very large number of people. So it's good to know where to turn for that. So I think sometimes primary care physicians can be overwhelmed with the number of things that they need to help their patients deal with. So sending them to us is a great way to help people when they say to their primary care physicians or their loved ones, I have this ringing in my ears, or I have this noise in my ears, I didn't used to have it. It can be pulsatile, meaning it kind of has a beat to it, like a heartbeat. It can be steady. It can be something that keeps them up at night. Some people have learned to kind of sleep through it, but it's still very bothersome to them. That is something that relates very strongly to hearing.
Absolutely.
What I end up telling people is, to me, tinnitus is there long before you're hearing it. It's sub-threshold, and then something seems to trigger it. And oftentimes people can point to this day, it was August 13th, or it was, right after I had my surgery, or it was right after this, during air travel, or, after we landed, I started to hear this sound. So oftentimes they can pick a particular time and they say, I must have done this, or what caused it. So the cause can be the cause to me is it is related to that hearing loss. There has been a hearing change. There's been some change in the auditory system. There just isn't always a way to say this is the exact thing that changed that auditory system.
Right. The causation for sure is not necessarily
it's not always
something we can get at.
Right.
But yes, but people, I do agree with you. People in general know very specifically when it started, and I think a lot of people tend to ask me, "Is this something that could possibly go away?" And there are temporary hearing issues, temporary threshold shift, temporary tinnitus. It is possible.
Right.
But for a lot of people, it can be a long-term thing. But thankfully, we have some ways that we can help. I don't know what you tell people, but I always tell people that hearing aids, they're sort of like a twofer for some people, for some tinnitus.
That's exactly right.
You get the benefit of amplification help, and also sometimes it will mask out the tinnitus in your head, which is generally more agreeable to people.
And that's even just the first line of defense on tinnitus help with hearing aids. So if they wear hearing aids just very briefly, we can see for the majority of people that they will notice their tinnitus less while they're wearing their instruments.
Right.
But the long-term goal even is that they notice it less when they take them off at night, which is so key, because so many people say, my tinnitus is worse at night. When I'm stressed, when I'm sleep deprived,
when it's
fatigued, when it's quiet, all those things come together. That's a pretty powerful storm of things, and people really notice their tinnitus more. So that is a goal with hearing aids. So providing the appropriate fit hearing aids, and then there's tinnitus sound therapy that we can supply in the hearing aids. That's a really powerful rehabilitative effort, and people will often report that things are getting better for them over time. So one of the reasons that we want to see people on a regular monitoring basis is because we want them to get that support for the tinnitus as well as for the hearing loss.
Yeah, absolutely. So I find it's very encouraging that we can tackle two problems with hearing aids as a first resort, but we have other options, which is great.
Right.
So if you want to talk about some of the other options for tinnitus.
Right. Well, and we don't want to leave out that first they should be seen by a physician to make sure there's no medical information that's being missed.
Definitely.
The ENT would see them first and rule out any medical needs, and then we would see them for the hearing test as well as for the tinnitus management. But there is something that we have started using within the past couple of years. It's a nighttime solution. So that's really cool because for people that have minimal to no hearing loss, they can be a candidate for using a pretty simple to use nighttime device that can reduce their noticing of tinnitus over time. So it's a 90-night commitment. This is a product called by Au.D Harmonics called Levo. So that's another really, really amazing tool that we've been able to use and had success with that for tinnitus sufferers.
Yeah. There's a customized solution for just about everyone, which is great because everyone's hearing loss is not the same. Tinnitus is clearly not the same. So the key I think that we focus on, I know in discussing with you, is really customization. It's critical, and I think it's wonderful that we're able to take the time to do that so well. In particular, we're on the same page, and we feel that that's just the utmost of importance.
Exactly. So getting to know the patient, getting to know their needs, and then mapping out a treatment plan is key. So
it is. It's probably a good idea to just let people know that no matter where you fall on the spectrum, we can guide you toward what you might need with your hearing. The cochlear implants are available, and it's something for the severely hearing impaired that we can get you in touch with the right people to get you down that path if that's something that we can determine after a hearing test.
And it's important, I think, to know about cochlear implants that it's not for people that have, mild to moderate loss, because sometimes I have people saying, I'd like to have a surgery to get my hearing loss corrected or my tinnitus corrected. It's not that. As you mentioned, the key word was severe to profound hearing loss. So someone that's no longer able to make use of a hearing aid. In other words, you put a hearing aid on and they're not getting any better clarity of speech. They're not getting much in the way of sound at all.
Right.
And those people then would be a candidate if they choose. They don't have to, but they can be considered
but it's
a
about
candidate.
options, which is great.
Options are great, yes, and that's a good one.
It is. It is. Thank you for tuning in with us. We were really happy to share some information. We'd love to get the opportunity to meet you in person and customize any kind of solution you need and help you with any of your hearing needs. We would be thrilled and honored to see you here.
It'd be great to meet you. Come on in.